This section of our program will focus on how to integrate the student and teaching into your busy clinical environment. The first step in this process is to let the student conduct their own evaluation on your patient. Let them perform this task on their own. They will develop their confidence and experience much more rapidly this way. Our students are capable of conducting a focused history and physical and then coming out to present the patient to you. The students learn a lot of clinical medicine in the course of working in your office. Working with your patients helps round out what they've learned in their basic and clinical science courses at the school. If you are able to observe your student performing a history and physical, your feedback is extremely valuable. Once the student has completed the exam, let them present the patient to you. Be sure that they follow the correct procedures. Guide them to get all the necessary information to make a good diagnosis and plan. Force them to commit themselves to an assessment and plan. That way, you'll learn what their knowledge base is and where the gaps in their knowledge are. At this point, you can critique them. Compliment them on the things they've done right, but then suggest improvements on the things they've done wrong. Next, you and your student will see the patient together. This gives the student the chance to observe an experienced physician interacting with their patient. It's very important that each student perform a complete history and physical once during the 5-session rotation. If there isn't time in your office, please send them to the hospital or the nursing home to see a patient who would allow a thorough history and physical to be done. Feel free to review the history and physical yourself with the student. However, we will grade it in the office according to a standardized format which they have been taught. If you are an elective preceptor, consider yourself an ambassador for your discipline. If you can give the students hands-on experience in your setting, they would love it. If you can't, please try and help them see what it's like to practice in your field as much as possible. The last step in hands-on learning is having the opportunity to ask questions. Encourage your students to write down their questions on a pad of paper, so that when you have a break or lull in the day, you can review the questions together. We suggest setting aside a few minutes at the end of each day to talk with the student and answer any questions that they have. This is also a chance for you to give the student feedback on their performance for the day.
I can teach them what I use and what I know, and I learn a great deal from my students. It's a teaching thing for me, because I'm not afraid to ask them, well, what are they teaching you about this or that?
Really push their students and to really to trust them and to really just teach them things of and the art of being a doctor.
In this section of our program, we'll look at how you can give your student constructive feedback to help improve their professional skills. We've all heard that practice makes permanent, so it's your job to let the student know what they're doing wrong. Please correct bad behavior as soon as possible. You may correct physical exam techniques during the exam, but avoid pointing out other mistakes that the student makes in front of the patient or in front of your colleagues. You might want to set up a verbal or nonverbal signal for your student to let them know when you want them to step back and observe. When time permits, have the student leave the room with you so you can consult with them. Once you are in a private setting, let them know what they did wrong. Be sure to be specific when pointing out incorrect behavior. Let the student know the possible outcomes if they allow this type of behavior to continue. Be sure to let the student know that this is not a personal attack, but rather a chance for them to learn and grow as a doctor. Try using a feedback sandwich. This involves a compliment, followed by a suggestion for improvement, and ending with a general compliment. It's an effective way of delivering feedback. Praising good behaviors helps the student continue to use effective techniques that they have already developed. It also gives them a positive feeling about their career choice. A doctor with a positive outlook is a doctor who will go the extra mile to ensure that their patients get the best care possible. Your role as an evaluator is very important. Physicians are able to make rapid judgments about the status of patients, and these skills carry over into evaluation. If you have negative feedback that's too delicate to discuss with the student, please call us at the office and we will help you handle it. In the rare case that a student conducts himself or herself inappropriately, please call us right away. We will protect you and your patients from inappropriate behavior. At the end of the 5-week session, you will be asked to fill out an evaluation on each student. Keep records of the strengths and areas for improvement for each student. This will make it easier for you to fill out the evaluation. The students really will read your comments and take them to heart. This provides a great opportunity for improvement. If you are an elective preceptor, your time with the student is brief. You do not need to fill out an evaluation. However, we welcome any written or verbal feedback you may wish to give. Our job at the College of Medicine is to ensure that each of our graduates is a quality physician. Thank you for teaching our medical students. They're so grateful to work with you and your patients. Congratulations on joining a long tradition of outstanding clinical teaching at the Texas A&M University System Health Science Center College of Medicine. You are making a big difference in the lives of each of your students, and you are helping shape the doctors of tomorrow.
I think anybody who doesn't do preceptor, anybody who doesn't do teaching, not only violates their Hippocratic Oath where they promise to teach, even though we sometimes forget that, but they violate their own self, because we're called to help. We're called to make better doctors, and in reaching out through a student, we can touch far more patients than we'll ever touch by ourselves.